Hi, my name is Melda Music, and I am a neonatal nurse practitioner for Children's Hospital of Colorado. We are here at Platte Valley Medical Center with RN Amy Myers and Perinatal Director Carrie Montgomery. We are here specifically today to take a look at what sets this perinatal department apart from others with their use of the sepsis calculator. The Sepsis Risk Calculator, also known as the Kaiser Sepsis Calculator, is a multivariate risk assessment tool establishing the risk factors and the newborn clinical condition. It provides an infant's individual risk based on clinical appearance and uses objective data and not just clinical diagnosis of chorioamnionitis. It results in a relatively few well-appearing infants being treated empirically with antibiotics. Platte Valley has a level 1 and a level 2 nursery, also known as a special care nursery, or SCN, with an average of about 65 births per month. Level 1 is the regular baby and mother unit, and level 2 is their special care nursery. They've both been using the sepsis calculator since July 2018. It has been a successful tool with fewer admissions to the special care nursery for empiric antibiotics. It's also helped us draw fewer labs on our newborns on the mother-baby units, such as CBCs and blood cultures.
Hi, I'm Amy Myers. I'm a special care nursery nurse here at Platte Valley Medical Center. I'm here to talk to you today about the use of the neonatal sepsis calculator and how we use that information to determine the care of our infants. First, we use a special tool. We call it the orange sheet, but really it's just a cheat sheet for the nurses to gather all of the information that they're going to need to help determine the care of the baby. On that sheet, there's specific information listed, such as the gestational age of the infant, whether or not the mother is GBS positive or negative, the length of time that her membranes have been ruptured, any sort of fever or any other thing that we might have seen that would impact the baby's care. We use that sheet and as a tool to report to our neonatal nurse practitioners as well as those other participating in the infant's care to make sure that we have a plan for each infant. Once we get our orange sheet filled out and we notice that there might be risk factors, we're going to assess that baby at delivery for those risk factors. For example, is the baby tachypnic or breathing too fast? Is the baby struggling to breathe in any way? Do we have a fever? Do we have a low temperature? Do we have a blood sugar issue? So we're going to be assessing all of those things, pulling those pieces together and entering them into our neonatal sepsis calculator to give us an idea of how this infant needs to be treated. Once we've established what the neonatal sepsis calculator looks like, we can then report back to our nurse practitioners to determine what care we're going to provide. Once you do the neonatal sepsis calculator, it's important to remember that it doesn't need to be redone. All the information that you put in there will continue to guide the care of the infant throughout their stay. When we are charting the sepsis calculator, once we have put it into our neonatal sepsis tab, there's a web link provided that populates the information into that. We then translate that data into a note which gives us some color-coded information. The three colors listed in there are green, yellow, and red. Those colors of information allow us to determine whether the baby is well, equivocal, or ill, and how we need to treat them. Again, once that's in there, we don't need to go back and do it again. We just continue to use that same thing throughout the baby's stay. We chart the information and again continue to provide updates to our providers as to how the baby may be progressing through the levels of care and what new things that baby may need. Once we get all of that, we've determined the baby is stable, we can transfer them to the postpartum or well baby unit. Then we use a handoff, a face-to-face handoff, and again some more tools to help us understand where that baby is. We go over in the computer what that looks like for each baby because again it's going to be different. Is the baby a green, yellow, red? Is the baby a yellow, yellow, red? What does that baby look like and what do we need to be watching for? And then we speak about what needs to change on this baby before it would be admitted to the special care nursery, what kind of things we would expect to be looking for. Once that baby would be determined to be ill and need to be treated, then the provider would determine that that child would need to be admitted to the special care nursery, and then we would begin to treat them with antibiotics or whatever that infant called for.